their own experiences of mental or emotional distress. When someone like me can say, I have panic attacks, and know that it's a common experience, is being discussed openly on the airwaves, over the internet, and in common conversations. So more people will feel comfortable to seek help than maybe had ever sought help before. But this new and unique point in history presents new challenges as well. We run the risk of separating out people with experience of a mental health difficulty into marginalization in our communities, into social exclusion, into lives of poverty, into living shadow lives in the community, out of the mainstream of Irish life. And that is where we are at now, when we know that most people with a long-term mental health difficulty are outside the labor force, are not given maybe the same opportunities to work and to earn a living for a good quality of life. We also risk failing to meet the needs of new and long underserved communities who need mental health supports, people from ethnic minority communities who are living in Ireland, people in the deaf community, the traveller community, people who are homeless, people who have a disability. Crucially, in an era where the doors of the asylums have almost all closed, there is the risk of having nowhere to go when someone needs help. And that is a new reality that we are facing now. This new era of openness about mental health also creates fresh challenges for the health system, and which up until now has maybe, perhaps, been focused mostly on people in the most severe distress. Because now more and more people are coming forward to seek help for their mental health difficulties, and they want a good quality service, and they want choices in their treatments. They want to have access to psychotherapy as well as medication, and they want peer support. They want services when they need them beyond Monday to Friday, 9 to 5. They want the right to be able to get a job even if they do disclose a mental health history. They want to be able to get housing so that they don't end up trapped in an expensive hospital bed when actually all they need is a home. And they want their rights protected. They want to know if they end up in a mental health inpatient unit that they can have the confidence their human rights will be protected. It's quite clear that despite the efforts that have been made since publication of the Mental Health Policy, A Vision for Change, our current mental health system is not yet ready for the full scale of these challenges. Last year, we still had a third of children admitted to adult wards, and CAMHS waiting lists were still high. We still have mental health staffing that is about a quarter below what was considered necessary in 2006. Some parts of the health service have been in crisis in the last year or so. We know that since September, the HSE's mental health service for older people in Donegal has been closed and is returning referral letters unopened due to the lack of a consultant psychiatrist. We know that a similar closure took place in the child and adolescent mental health service in Waterford last year. And services are sometimes turning people away who don't fit into the clear service categories. People like those with an addiction alongside a mental health difficulty, for example. People for whom the system is not working to its best yet. 775 million euro was spent on mental health services in 2015, and that's an increase of 89 million euro since 2011, a substantial increase in funding. And this funding is making a difference. We have a counseling and primary care service that did not exist in 2011. We have liaison nurses for self-harm in A&E units. We have more allied health professionals working in mental health teams, by far more than we had, proportionately speaking, than in 2006. But the services are still struggling, as I've described. We have little information, actually, about the scope and provision of the services for that $775 million. We still don't know how many people use mental health services, what treatments they receive, what choices they are offered, how long they wait for treatment, or whether or not these treatments actually help them to recover. And crucially, services still vary greatly from one area to the next. One county may offer home treatment, another may not. One may offer 24/7 crisis support. Another may only operate 9 to 5 and refer people into A&E outside of those times. One GP may refer someone to counseling. Another may not be aware of the counseling service. One service may work well with family members to develop a recovery plan for their loved one. Another may ignore the valuable insights of families living with an individual in distress. So despite real progress, there are still huge challenges to meeting the mental health needs of the people living in Ireland. It is within this context that we come to listen attentively to what the candidates have to say about their plans for Ireland's mental health system. I believe that the next government can take concrete steps to improve the mental health and well-being of the people of Ireland. And our coalition, Mental Health Reform, has published a general election manifesto that offers some suggestions for specific actions. You all will have received a leaflet that condenses those specific actions into some shorthand highlights, and the full manifesto of mental health reform is available on our website. We think it's important that we have a timeline, resourced, whole-of-government action plan to reform the mental health system. We think it's important to build up the capacity in primary care so that the mental health services are not left to try and handle the whole picture, but that there's a robust system of primary care mental health that can help people early on when they're experiencing difficulties. We need early intervention for families where children are at risk of developing emotional and behavioral difficulties. And we need a much more developed school program to build children's resilience. We urgently need to update mental health law so that anyone can feel confident their rights will be protected when they enter an inpatient unit. We need to ensure access to housing and visiting support so people who use mental health services don't end up having to deal with homelessness on top of their mental and emotional recovery. And we need to make concrete steps to ensure that people with a mental health difficulty can have real opportunities to work and enjoy a good standard of living. These are some of the mental health reform as a coalition suggestions, but really, I, like you, am here to listen, and I'm hoping that we will hear some very insightful and encouraging commitments, and I look forward to the debate. Thank you.
Thank you, Shari. Now, this is, we have until 8:30, which is, in one sense, a long time, but it's also going to be a short time because I know there are so many questions in the room, and there are questions too, which will emerge from what our panel of politicians and candidates have to say. So let me introduce the panel. From the nearest person to me, Kathleen Lynch is Minister of State with responsibility in the Department of Health on this agenda and represents the Labour Party. Regina Doherty TD represents Fine Gael from Meath. Colm Keaveney TD is Fianna Fáil spokesperson on mental health and is a TD for East Galway. Caoimhghín Ó Caoláin is Sinn Féin spokesperson on health, representing Cavan Monaghan. Michael O'Dowd is standing for Renua in Louth. Anne Walsh represents the Green Party in this election in Wexford. Sarah Jane Hennelly is Social Democratic Party in Limerick, and Richard Boyd Barrett is TD and represents both the Anti-Austerity Alliance and People Before Profit, and is standing in Dún Laoghaire. But just before we start, I'm going to ask Regina Doherty to tell us, because she's very close to Enda Kenny, when the election will be. So just between ourselves, Regina, we need a scoop.
Definitely sometime this year. Definitely.
Well, so it'll be a democracy anyway. Okay.
Very
If you were a betting woman, what date would you put your money on?
I only hear what you hear, which is the speculation in the media. I mean, I get most of my gossip from the journalists walking around downstairs. I certainly don't get it from Enda Kenny, but I think the general consensus is that we're at the end of February now, is that?
On a Friday.
Yeah.
Okay, last Friday in February.
If you lose money at Paddy Power, don't blame me.
So, thank you very much anyway. So, look, I'm going to ask our speaker, you just heard, Shari McDade, from our host tonight, Mental Health Reform, to put the first question. And would I also alert those of you who have already put in questions to be ready to pick up when I call you. And one other point, I've already told the panel this, and I'll make the point now to Colm Keaveney as well, who wasn't with us just before we started, and that is that I'm going to encourage the panel not to repeat points already made, but if they're in broad agreement, to say that they accept the point made by X, but they want to add this or that to it, rather than in a lot of the agenda there's a fair amount of consensus. It's sometimes whether it can be operated on which becomes the issue, and I want the audience to participate very much as well. So, but Shari McDade has a question. Yes, Shari.
Thank you, John. And I have to say, I didn't, quite clumsily, I didn't introduce you, and I hope that's because everyone knows you so well that you need no introduction. So, a simple question: given that Irish young people have a high rate of mental health difficulties, and that Ireland's suicide rate has not fallen significantly in recent years, what do you plan to do to really make a difference to improve the mental health of the population of Ireland?
Well, Minister, as the person with responsibility for this agenda for the past number of years, how do you answer that question?
Well, I suppose I answer it by saying that the suicide rate is reducing, not as quickly as we would like, or indeed I'm convinced that we should have a zero tolerance attitude towards suicide, but then I don't think we'll ever reach that point, but I think that should be our attitude. What I have done and what I will continue to do if re-elected is we introduced SIPSI last year, which is counselling and primary care, and that was very clearly directed at people who are over 18. This year, with additional funding, we're going to ensure that it's everyone under 18 as well, will in fact have SIPSI available to them. Secondly, we are developing a perinatal service. It was pointed out to me very clearly that in Ireland we appear to have very low rates of postnatal depression, but it is because we simply don't look for it in pregnancy, and we're the same as any other country in Europe. Of course, our rates should be about the same. We're not that different, so we're going to develop a perinatal service, which will be someone that will develop a pathway in order to ensure that within the maternity services that there will be in fact someone that will detect, I suppose, very early stages of postnatal depression and prenatal depression as well, and deal with it in that way. I have always believed that we have started our services in relation to, I suppose, Pierce Finnegan is there, and I know that he'll say psychiatry. I would like to join the two of them, psychiatry and mental health. I believe that we've always started it way too late. The notion that somehow or other that very young people don't suffer the type of anxiety and which we all know they do, whether it's stress from exams or social pressure, indeed social media pressures now. And I believe that we should be starting that at a much younger age. I know that in North Cork and in some other areas of the country it's patchy. No, I have no problem in saying that. Okay. It is patchy. We do have an infant mental health service as well. And I believe we should develop this throughout the country in order to ensure that at a very early stage, people who do develop problems are caught very early. That early intervention piece is so crucial. But I believe that's what we should do.
Okay,
and,
Minister, thanks.
Have done a lot in relation to
Richard Boyd Barrett.
Yeah, we think, first of all, we need to increase the proportion of the overall health budget that is going to child mental health. And indeed, we think we need to increase the proportion of the health budget, double it, in fact, that is going to mental health generally. And as part of that, ensure that at least 25% of the mental health budget is going towards youth mental health. We think that we need to resource and staff primary care, occupational therapists, speech and language, therapists, psychologists, and so on. So at an early stage, there's services available for people to go to. I think even at the sort of classroom level, I think SNA cuts, resource hour cuts, and so on have been detrimental, because I think, you know, if you've got huge class sizes, it's much easier for kids, if you like, to be just, you know, alienated and isolated and disengaged and so on. I think they can often, in many cases, even be wrongly diagnosed as having mental health problems, when in fact what they need is a bit more one-to-one attention and just more teachers engaging with them as individuals. Obviously, we need round-the-clock emergency services, which are not, in many cases, available. And again, that's to a large extent, that's a resource issue about providing the staffing that we don't have, that isn't adequate at the moment. And one other thing I would just say, I mean, in a way, it's maybe another issue, but I am very worried by the number of kids who are being put on drugs, basically. And I think drugs is the cheap way to deal with a problem that is actually caused by lack of resources at the basic level. Even things like, well, actually not even things, like crucially things like housing, right? I mean, how can you have good mental health if you don't know where you're going to live, if you're living in a hotel, if you're in emergency services, if your mother or your parents are at their wits' end because they're in those sorts of situations. So I think it is about resources at the basic level in school, and reversing the cuts in the service areas themselves, and really asking questions about whether drugging kids is the best way to deal with problems that are really social problems.
Okay, Sarah Jane Hennelly.
Yeah, I suppose we would be kind of looking at the need for long-term planning, I suppose, in the area of mental health, and long-term planning kind of coincides with the idea of prevention, early intervention in schools, looking at getting people in their communities, helping parents, especially parents struggling with mental health difficulties, and helping them to cope within their families, and all of that emanates outwards then to allow a child to grow up in an environment where they can nurture positive mental health and they can be educated about it. So I think that requires long-term thinking, which unfortunately is, if we leave it to the political system as it stands to achieve this, it won't actually happen, because we do have a quite short-term view on things. And I suppose as well, we are significantly lower in terms of our investment. We're at 6.5% of the overall health budget goes towards mental health. If we were to aspire to have the best mental health services in the world, they have about between 12 and 14% of their overall mental health budget. And it's not just, I mean, we don't have a particularly strong track record of dealing with mental illness in this country, and that's a given, but since our priorities have shifted as well since about the 80s. We were, I think at about 10% at that point. And since then, since cuts had to have been made, the first people to be hit were the people in mental health. That's where the jobs were taken. We're already at 22% below staffing levels. And then if you couple that with the cuts, I think there's been about 11,000 jobs lost in community and voluntary sector since about 2009. They're the people who access people in their communities, in their homes, and figure out what their needs are. So if you couple those two together, they provide family supports. We're in a really desperate situation. So we need more, I think, long-term thinking and a commitment to it. We're very far behind at this stage.
Okay, Colm Keaveney.
My apologies for being late. I have what they call a canvasser's flu, so I'm having...
You weren't late, you were here in time.
My apologies again.
Okay.
I think that, John, that next year is the 10th year of the Vision for Change, and we need a new strategy to roll out and put children front and centre, in particular the CANS service that we offer. And when you analyse the work over the course of the last number of years, I would argue that the political will wasn't there to provide for the recruitment of specialist staff, to ensure that we had the ward in the community, the specialities to tackle waiting times for children who wait exorbitant amount of times, for acute services in their homes and in their communities. There are black spots across the country where children wait up to 2 and 3 years for appointments. And in what I would argue is an acute requirement, that is significantly unacceptable. I'd also like to see the Department of Education play a role, particularly with respect to CBT. And I think we should pilot, certainly across a number of schools, a review of the wellness of children and how they analyse their own dark cloud, to give them the capacity, as Richard had said, to understand emotionally where they're at without stigma. There are a number of wonderful projects across the country, and there's one in Facton Court called the Amber Flag. And it's an acknowledgement for schools, clubs, societies, who put protocols in place with respect to speaking out. I come from a town that wears mental health on its sleeve. It is one of the original community-based, open community mental health services. And my children, play and hang out with children from service users of the mental health service. So there is no...
So are you saying that both in Galway, in your own town, and in Cork, that there are models there?
There are models we should look at.
Which might be best practice and could be replicated?
Indeed, in the UK and the NHS. The CBT is being piloted, I think, in 8 schools across the water to enable children to teach and give the management capacity to teachers to actually roll out a syllabus around CBT and to get children away from the immediate prescription of drugs. And particularly with early intervention, there is a very strong sense that GPs and the system are administering drugs very quickly.
Okay. Caoimhghín Ó Caoláin.
I think, first of all, as with all other aspects of mental health provision, focusing on young people, as the question invites us to, we have got to address the under-resourcing, the failure to provide sufficient funding to address the whole complexities of mental health needs. The 6.5% is likely to be the figure in relation to the percentage of the overall health budget expended in 2015. And a vision for change going back to 2006, 9 years ago, indicated that we should be working towards a 10% of the overall budget spend on health directed to mental health services. We're quite some ways off that. In previous years, we have exceeded the 7%. We have got to set a pathway that will ensure that within at least a Dáil term, that over a 5-year period, we would be able to bring spending in mental health up to the suggested target of 10%. We have got to as well, and not only affecting young people, but oftentimes from my own experience dealing with young people and families, particularly in crisis situations, they don't know where to go. We need 24/7 crisis intervention services. That's absolutely essential.
We actually have a question on that later, so I'll be coming to you in detail.
Well, I'll mention that because I think that these are essential families, parents, coping with a situation. It can't be 9 to 5, Monday to Friday. That's not acceptable. In relation to young people, very particularly, I think we've got to address the fact that our child and adolescent mental health teams have not all been established. They don't all, and very few, have all of the necessary component parts in terms of the essential professional skills that are required to make up the CAMS teams. It's very, very important that that is addressed. Child and adolescent, the focus in relation to children and adolescents and their mental health is where you start and hope to curtail the development of more serious mental health challenges in later life. We've got to recognise that we're still seeing young people placed in adult psychiatric inpatient beds. That is simply unacceptable. I don't know the figure over the period of 2015, but certainly in 2014 we had 89 young people admitted to adult psychiatric inpatient beds because we don't have the full complement of numbers, and again there's 108 beds that should be open for admissions in relation to young people. I would like to also indicate, there was reference to schools. Schools have a hugely important role to play in this, and it's not only the Department of Health. The needs in relation to mental health go across a number of departments. And the Department of Education, in relation to guidance counsellors in our second level education system, there were significant cuts going back over these recent years, and we need to see something in the order of an additional 700 guidance counsellors across our second level education system in order to be there and accessible to young people, not only to impart the importance of respect, and respect is a two-way street. It's a hugely important lesson for all in those early formative years, but there is supports. There is supports, just as Shari at the outset of the meeting indicated, there are supports here for us too this evening. We need those supports in our schools. And just lastly, in relation to suicide, because the Minister had made the point, we need to see SCAN nurses, that's the suicide crisis assessment nurses, right across the board. We don't have the full complement of the 35 that were recommended in situ. They need to be there. They have an invaluable role to play, and not only in relation to the needs of young people, but right across the board.
Okay, Michael O'Dowd.
Yeah, if you just pick up that point in relation to education, and agree with Caoimhghín in relation to the guidance counsellors in secondary schools. Now I know part of that, those cuts have been reversed in the current budget, and that is welcome, but they certainly were the first point of contact for individuals, and the first red flags that could be raised were done generally by guidance counsellors that could then refer individuals on for further support. And I mean, in terms of, and I helped draw up the manifesto policy in relation to Renua on this issue, and I spoke to a number of guidance counsellors, psychologists working in the primary education, and also counsellors in third level. And certainly what I've heard from the counsellors in third level is quite frightening. What they're saying is that there's a tsunami of problems coming through from the second level, and they're extremely concerned. And they put it down to a number of reasons, but generally down to the austerity that families have gone through. And that young people for the first time have a bit of freedom when they go to third level, but with that freedom they've also lost the support of family, friends and schools that they were used to. And it is a huge problem.
It's a very big challenge, isn't it?
It's a very big challenge.
For a significant number of the second pupils going on to third.
Yes,
it is. It's a sudden change where they're responsible for their own.
Yeah, it's a transition almost into adulthood, and some lot of people just don't have the skills to cope with it. One thing I heard quite recently in the last couple of days is that generally when young people go to the counsellors in third level, it's a free service. It's offered free, but I'm told that because of pressures on budgets, that now quite a number of third level colleges are considering a fee for that service. A nominal fee, they're saying €5, but the history of nominal fees is that they'll get bigger and bigger. So that's a concern. So, I mean, in a sense, the safety net in third level are their peers. You know, the USI that have a number of fantastic programs. It's not okay to be okay. Are you well? Spun out.ie that people are aware of, and I think they need to be supported as well financially if necessary, because they're doing great work.
Okay, Walsh.
Hi. Well, I suppose I work in this area, so I deal with adolescents all the time on a day-to-day basis. And from a Green Party's perspective, it's a long-term vision. It's where we're looking at prevention, very early intervention, and just a sustainable model. And it isn't rocket science, and it doesn't need to cost millions. I do this every day. I know what works and what doesn't work. And it's really, really important that there is a shared perception and a common language among professionals, because you've got a CBT model, you've got a psychoanalytic model, you've got this model, you've got that model. Spare me. You know, if you sit down with a teenager with an app called 3D Brain and you say, this is how your brain works, this is what you need to do to calm down a little bit, this is where this might be coming from, have a chat with them. Richard said earlier, and I think Michael mentioned it as well, it may be the environment, there may be environmental stressors, you know, so you've got to look at that. The more capitalist a culture is, the more mental health problems we will have. So if we have a boom-bust cycle, we're going to have more mental health problems. If you have a collective society, far less mental health problems. Another thing is we have this overarching medical model, which is cyclical. You have people going in and out of psychiatric care. And I work with young people with Youth Reach, but I also work privately. And when I work privately, I get the people who the system hasn't worked for because they're in and out of it all the time. They're in and out of it because they've been medicated to such a point. There's a place for medication, absolutely, but it's only a small place. Has to be a holistic approach. It has to be. This affects the healthcare system in general, because 60% of all illnesses are stress-related. So if you tackle mental health, you tackle physical health. You're talking about going into education then as well. You're getting in there. This affects education. Even our criminal justice system. My background is actually in forensic and criminal psychology. In there, an awful lot of the people that are going through the system, and I work with vulnerable young people as well, have anger issues. Anger issues get people into prison. Anger issues are emotional issues, maybe based in trauma, maybe based in social deprivation. So unless we've got a plan that really understands where human suffering is coming from, we're at nothing. We can talk about budgets, we can talk about models, but we all have to work together. Shared perception. Listen to a wonderful psychiatrist, actually, Malcolm Garland, talk about the model we have at the moment. There's no joint up thinking every healthcare profession should be trained the same way. You can't have somebody going and saying this works, no, this works, let's try this, let's try this. There has to be a common language, and they all have to be speaking the same way. So there shouldn't be psychiatrists, psychologists, psychiatric nurses, GPs working in this area. They should all have the same training. You know, so if that's a proper long-term vision. In the meantime, effective therapy does not have to cost the earth or take for ages. If you are there and you're explaining to that young person how their mind and brain work, like I said, how to get their cortisol and adrenaline levels down, doesn't mean you're going to sort the problems of the world in 1 or 2 sessions, but you're normalising it. Over 50% of us will have mental health issues. They start with stress, anxiety. Sometimes it's trauma, people that needs to be dealt with as well. But if you can very early on teach children how to emotionally regulate and teach them how to deal with situations, and Colm actually mentioned it a little bit earlier with the CBT, even though that's just one little strand. There was an amazing program in the States. Martin Seligman, it basically was immunising psychologically. So if you teach kids skills, really good skills early on, depression, the rate of depression for those children is way down compared to the kids who haven't been taught those skills. So a proper model of psychoeducation that is not a bit here, a bit there, a bit every place else. You know, so the thing about it is it's a vision, it's a long-term vision, and it can't be about just so I can win an election, or we'll say we'll spend more so we'll get more votes and promise the earth. You know, it's not about promising the earth, it's about saving the earth. I'm from the Green Party, so apart from that, but it's about saving all of us as well, right? So we've got a triple bottom line. We've got the environment, within that we've got the economy and society, and the most important thing is we have a psychologically well society, so we can have a good planet, a good place to live, and we can all connect up the dots together and look after each other, and unless we do that, we're at nothing.
Regina, go ahead.
Can I say I agree with everything she said? I do, and not to be flippant, but I think some of the queries that were raised by other people I'd have to disagree with. We do have a long-term plan, and it isn't just the Fine Gael and Labour plan, because the Vision for Change was a document that was created with statutory bodies and people like yourselves with vested interest in this business 10 years ago when Fianna Fáil and the Greens were in government and the PDs were. And actually it's interesting, I sit on the cross-party mental health committee. So does Caoimhghín, there's a representative from Fianna Fáil, people from Labour. There's about 5 or 6 of us, and we consistently meet with Laura and Shuri maybe a couple of times a year. We all want the same things, which is the same as what you want. And when you look at the manifesto that that you've received in your leaflets tonight, we all want and aspire to having 24/7, primary care facilities for our children. We all want them to be broadly enabled in our schools to be able to fight and to challenge the very serious challenges that they're actually facing today that I didn't face in school, and that most people in this room didn't face in school. They have very different challenges that we would have had growing up. We want them to be empowered and equipped. And I think what Anne had said there is proper modular psychoeducation is something that genuinely needs to be looked at, and not from a mental health perspective, but from a school educational perspective, and to be empowered. But I can't let it go without saying the programme that's currently being enacted is recognising that we do have difficulties and challenges with our youth. Go back to the question that Shuri has posed earlier on. We are employing extra personnel to look after CAM so that we don't have children being looked at out of our services by adult mental health services. There are challenges in recruiting those people. We are experiencing them, and so is every other European country. But we're doing our best to make sure that we fill the gaps and to provide the level.
Do you mean you're advertising the jobs and you've
they
not
absolutely
enough
are being
applications?
advertised. Yeah, they absolutely are. But at the same time, you have to recognise this is a dynamic business. You will employ somebody over here, and somebody over here will go on maternity leave, or somebody over here might leave because they move to a different division. It's a dynamic moving employment situation, but it's not something that we're ignoring. It's definitely something that we're addressing. We're also empowering children in schools through our jigsaw models. We've got 2 new jigsaw programmes being funded and supported this year. We have 2 new clinical programmes being rolled out this year with regard to ADHD and substance abuse, and the other one is around dual diagnosis of children with mental illness and other conflicting diagnoses that they might have. That's being addressed. The whole issue of psychiatry in later life is another channel that's being addressed. The whole issue of, as Kathleen had mentioned, the Minister had mentioned earlier on, of addressing the issue of perinatal counselling. I mean, the reason I signed up when I became a TD a number of years ago for the cross-party on mental health, and most importantly for the committee on mental health that Caoimhghín also sits on, is that 14 years ago was my first experience with the mental health issue, but there isn't a snowball's chance in hell I would have told anybody. I didn't tell my parents. I was mortified, I was embarrassed, I spent months accepting that I had to take tablets, but then trying to get off them because that meant there was something wrong with me. Even in my own head, it wasn't normal to have a difficulty. So I couldn't even address it in my own head.
But that's exactly what it was. It was normal.
Yeah, but I very much welcome today that society has accepted now that women can have postnatal depression. It's not the end of the world, and it usually results of a trauma in pregnancy. It's different for everybody, but there's a reason for it. It's not just some madcap thing that happens to women because they have the baby blues. It's a significant reason, and we need to address it and deal with it and help women in those instances. In exactly the same way as there's significant reasons why our young people are challenged, why our men are challenged, our young men are challenged, why middle-aged men are challenged. And we go back to the old adage that it doesn't affect women as much as it does men because we're all mouths and we talk to each other. But there are a significant number of women in this country who are quietly and again under the radar going to their doctors week in and week out and getting prescription medication because maybe they're still stigmatised. So let's go back to community power. I'm not dismissing government's role and responsibility, and yes, we all want to get from 6.5% of the overall budget right up there to 10%. There isn't one of us that sits here that would tell you that if we weren't in government in 20 weeks' time or 10 weeks' time, that we wouldn't aspire to do that. But that aside, community power needs to be changed, and we need to shift our mindsets from the people who still feel that there's something wrong, that they're still not quite right, if there's something wrong up here. It's okay for something to be wrong as long as we recognise it and try and support and help each other. And I think that's something that has been missed in all of our campaigns. There's a great organisation in the schools called Caoimhghín Ó Caoláin. It's the young people's doll, and it is representative of every single county, and they come together on a quarterly basis to meet all over the counties together in Dublin. Their programme this year, their project this year is called Let's Go Mental. Now, okay, they're all going to have a rock concert and have a great night at the end of it all, but their strategic plan is to support each other in schools, in secondary schools, supported by government and funding, and supported by mental health reform, to be actually able to encourage children to be empowered, to talk, and to provide that peer support with each other, which is vital in the overall pie and graph of where we need to get to. So yes, we do need to fill and recognise the challenges that we have in agencies and the provision of services, but we also need to fill that very big gap that we need to support each other in communities, and our peer support, I think, is vital.
Okay, I have a lot of offers from the audience. So this gentleman here.
Jamie Harrington, I'm a mental health activist, 7 in.
Okay, the microphone is coming in. Yeah.
Oh, sorry, I have a big mouth. Someone spoke there about the mental health services for young people. I was a user of the Mark Ham services in my area in Ballymun, and my first experience was going into this horrible grey room, sitting down, and the person in front of me said, "So what's wrong with you?" And I went, "That's why I'm here." And I went, "Okay." I spoke about what it was, and they gave me a prescription for 2 different tablets and sent me on my way. For the next 3 weeks...
You need to use the mic this way all the time, don't wave it around. Yeah. Oh, it's turned off, is it? Yeah, sorry. Yeah. Sorry about that.
He doesn't need it.
Yeah, if you stand up, the acoustics are good. Yeah, so we'll hear you.
The next 3 weeks of my life, the most horrible 3 weeks of my life. I was dull. As most of... and by the way, I've wrote to... There's 9 politicians on the table. I've wrote to 4 years, and 4 years have ignored me. The next 3 weeks, the most horrible 3 weeks of my life.
You're now too near the mic, sorry.
How about now? Am I alright now?
That's okay, yeah.
So what I'm trying to say, you're right, Richard, medication is not the answer for some people. For some people it is, but the doctors don't care. Doctors are going, quick fix, put them on some medication, get them out of my office, let's see the next person. Someone else also said something about schools. When I was in school, I was taught about the 1916 Rising, I was taught about the French War. I was never taught about how to look after myself and my own mental health. I was never taught to stand up and say, I'm not okay, I need help. If I hadn't went and got the help I needed, I wouldn't be here today, and it wasn't the HSC that gave me that help. It was services like the Samaritans, like Teen Line Ireland, like spunout.ie, and these services are being ignored when they're calling out for help. I know myself because I volunteer with Teen Line. The calls have went up by about 20% this year. 24,000 young people called us in 1 year to tell us they weren't okay. I know Samaritans' calls have gone through the roof also. The government needs to start looking at these services and thinking, what do we need to do? Teen Line's funding was cut by 100% because the National Office of Suicide Prevention deemed their services not necessary. The only dedicated teenage helpline in Ireland, and their service is not necessary. The ministers and the TDs and the people that are trying to get into power now need to realise that mental health for young people is a big, big problem. We need to start looking at it together. Instead of all these people who haven't a clue what's going on in a 17-year-old's lives sitting down at the table, invite the 17-year-old in. Ask them what's going on. Someone said they mentioned an app. We don't only look at our phones. Yeah, I spend most of my life on it, but I still know what's going on in the outside world. So when I go into a room, I don't want someone to sit and go to me, okay, we're going to look at an app now. Talk to me like I'm a real person. That was one of the main problems I encountered when I started using the services. I was treated differently, like I was sick, like I had something wrong with me. I wasn't. My problem, I was being bullied and I had no one to talk to. And these are the things, when you go into a counselling office, I now use private counselling because the HSC failed me and the Matter Cams deemed me finished my service. So I now pay €50 an hour to go and see a counsellor. That's what I have to do. What I'm trying to say is, we need to start looking at the services and seeing what we can improve. Firstly, making the services more welcoming. Nobody wants to sit in a grey room, in a dark room, talking to some random stranger about what's going on in their life. We need to make people more friendly. We need to make the services more friendly. I'd love to see one of the politicians that are sitting here today use the service for a year and tell you, come back to you and say how it is, because it's not right. Thanks.
Minister, what is your response?
Well, to start with, Teen Line wasn't discontinued because we didn't think there was a need for it. There were other reasons behind that, but not the forum to go into it, to be honest about it. The reason we are opening an additional 3 jigsaws this year, one in O'Connell's Temple Bar, one in Limerick, and another one in Cork, is because the type of facility that you describe is the type of facility that even not as a teenager I wouldn't like to go into. And Jigsaw and Headstrong and Spun Out and all of those, they are actually government funded, significantly funded by government. And we are going to put in place 3 additional. We also, by the way, in terms of access for young people in Limerick, which had a particular difficulty, we have given additional funding to ensure that young people with their night cafe, running it themselves, listening to what they have to say, they're getting significant additional funding. So it's not that we don't listen, it's that we do listen, and we listen very carefully to what is necessary. But you're dead right. The notion that you would go into a grey room where someone says to you, what's your problem? I suppose it's not what young people expect, but most definitely Jigsaw does work. And we will have 12 jigsaws this year right around the country to ensure that young people are heard, and that when they walk in the door, they're walking into an environment which they have designed. They have chosen the people.
You must
that
have got
will
lessons
work
from
there.
Michael D. Higgins on how to string out your sentences and just have another point to make, Minister. You're
John,
second only to Michael D. And he's no longer
John, I take that as a huge compliment.
Well, it is a huge compliment, but it doesn't help me in trying to bring in as many people as possible.
No, it doesn't.
We have your substantial answer, and somebody over here had their hand up earlier. Yes, the gentleman here. Yep. Yes. And can we, if I nod somebody, will they then covet the other microphone and wave the microphone at me? They'll get in all the faster. Yes.
Okay, thanks very much. I just say hello to the Minister. How you doing? Because it's probably the only time I'm going to get a chance to talk to you. I've been and long. And I've been outside your place of work as well, and tried to make an impression, but obviously I didn't. And I contacted the department as well, and I didn't get any response. And that's really part of the culture that operates. There's zilch, in my experience, of accountability. Going into a room with a psychiatrist, it just comes to mind, that I travelled a long distance to get to, and I wasn't consulted in relation to it. I was told if I wanted to meet a psychiatrist, I had to be there at a particular time. And a few polite words to start with, and then it was, to see why I was there. And I started sort of on the softer area of treatment, present treatment in relation to a family member. And then it went to longer term, which finished with the psychiatrist saying, and the hope would be that your brother would be well. And I simply asked what he meant by well. And what happened? The psychiatrist got up and walked out. Walked out of the room. I have asked questions, and you know this, in relation to all the decisions that have been made of discharge onto the street homeless, of non-transfer from a hospital down the country back into the hospital where he was previously treated and where he lived. And I've got no answers. There's been loads of decisions made along the line. It's obviously cover-up. There's a silence in relation to it. Part of the problem, I think, that has been mentioned, I agree a lot with what Anne said earlier, in relation to the view of mental health. What is the brain? There's a medical model, and it's views that the brain is who we are. There's other people who take a different view. And that's why they can say, well, these things happen in this part of the brain, and we'll give chemicals to sort that out. a lot of other people that experience, we're not just our brain. There's a lot more. And if you think of somebody with serious mental health difficulty, and their mind has let them down, and they've been told this, and it has, once they've gone through an experience and then come out the other end. And they're given drugs and more or less institutionalised in the hospital to a great degree, because they can't do anything for themselves, they're not allowed out, and so on and so forth. And then they're meant to go out back into the society without any therapy and counselling, and have usually a difficulty in terms of housing and jobs and relationships. They're right at the vulnerable bottom, and they're expected just to carry on and cope. That's not going to happen.
And is your point that they have been put back into society into quicker way, or that there should be a middle ground between
the biased very much in the psychiatric system, where people are who have serious mental illness is biased completely towards, as this young man said, towards medication. Medication has its place, as Anne mentioned. It's generally, I ask the questions, a different psychiatrist says in relation to, does it cure? No. Are there side effects? Yes. And the other question in relation to it, sorry, it's just gone out of my head.
But in many cases it does manage the problem for some people.
It brings people down if they're manic, and it brings people up if they're depressed. Yeah. Right, but it doesn't sort out underlying difficulties.
But perhaps there would be some settings where there isn't a solution, where there's only a therapy or a management.
And that's where the psychiatry usually work in, because they say, well, that's the person chose this or made these decisions. There has to be a recognition of the full dimension of the person's experience, whether it suits or doesn't suit. And that's not, it's like the easy, I think it was mentioned, the easy solution is to give drugs, because that pacifies them and for the society. Also allied to it is environmental issues. It's not only the housing has been mentioned and other things, but is the place and position in relation to the justice system, with the guards and the justice. And I've experienced this personally. In court, where in this case I have to say my brother was up in court, and the free legal aid and solicitor made a good case in the situation and explaining it, and there was something brought up. We're talking about innocuous stuff in relation to the words that was used, that he mentioned the guard in his big black boots, right? I know it's terrible to say something like that. And the judge said, we can't have people disrespecting the guards, and never looked at him once and found him guilty. And I've got no answers to any of these things. And so that all this talk means nothing to me. It's action in relation to it. Are the people interested? Do they want to have a real conversation about what is going on? And I'm sure there's lots of good things going on, and there's lots of people who are getting help, but fundamentally there's a problem with it. And it would appear, from my experiences, that the system, like many other, I'm unfortunate to say, of services, there's a cover-up culture, it's hierarchy, it's vested interests, and effective silence in relation.
Thank you for that. Yes. Yeah.
So there's a lot of talk here tonight.
Give us your name and organisation, if any. Yeah.
My name is Pierce Finnegan. I've worked in the services for over 40 years. There's a lot of talk here tonight about the budget for mental health. Apart from the Minister, from Minister Lynch, I would like to ask the politicians to give me the exact amount of the mental health budget as it is passed by the Dáil that is in primary care, in mental health and primary care. How much of the budget goes to mental health and primary care, not psychiatry, mental health and primary care?
And what's the important? Why are you asking that specifically?
Because psychiatry deals with mental illness. Mental health is dealt with in primary care, and everybody's talking about mental health. But I want to know how much of the mental health budget that they pass goes to mental health and primary care.
Does anybody want to pick up on that?
I'm a member of the Joint Oireachtas Committee on Health and Children, and while we do go through the estimates in relation to, it's not we who make the determination of the spend in relation to these areas. It's actually within the department and the HSE. I don't know the figure breakdown that you're requesting. It's certainly there, but I just wouldn't know it here this evening off the top of my head. But I do appreciate and understand very well the difference, the differential that you're making between the two.
But isn't it also the case that money spent earlier and effectively, and this relates to the education system particularly, is money well spent, because the cost to society of a dysfunctional family or of mental health problems is so high.
That's right.
And it's not only an economic cost, but it's a cost in terms of the family dynamics and well-being and so on.
The reason why I asked the question is, and I noticed that there's a lot of silence from the top table, is the only person that's actually taken up this and ran with it is the President Minister. She has stood by and demanded that money go to mental health and primary care, not all into psychiatry, not into an illness model. And she's the first person in 40 years that I've seen doing that.
Yeah. There is, Richard?
Well, I mean, I just want to relate the two issues, you see, of primary care and the drugging of kids, and I think they're related. If you don't have the staffing and the resources and the supports at the sort of at primary level, and at school level and at community level, then you try and fill the gap by drugging people. And the fact is, we have lost, we've lost about 1,000 people from mental health services altogether as a result of the austerity attacks, down to 9,000, whereas the figure set out in Vision for Change, I think, was that there should be 12,000. So we're 3,000 short of what was considered to be the optimum figure. So the reality, you see, there was a slogan the government had when these cuts were happening, is we're going to get more for less. And the truth is, we didn't get more for less. We got less for less. And when you haven't got the staffing and the resources at that primary level, then the pressure is on the staff that are left to just give out prescriptions, to drug them.
Okay, we have that.
So the
well,
two
we'll be
things
coming back to that specifically, and I've heard, we know your emphasis on it, Regina.
Well, I was just going to say I totally disagree. I mean, you're talking anecdotally, and I don't think it's very fair. Number one, to the healthcare professionals that actually are servicing this particular sector, and it's very, I think, unfair in government, but they'll get over themselves. Most of the people and the doctors who are giving our primary care support services do not jump to give drugs in the first instance to children. I have two boys at home, both of whom have difficulties over the years, and our GP services went to the nth degree to not have to give them drugs. So I think it's unfair just to anecdotally say that everybody's being drugged up their eyeballs, because that's not true.
Colm.
John, the mental health reform ran an information campaign last year around the HSE service plan, and the political will provided for some very small print in the service plan to ensure that recruitment took place at the end of the financial year. And that has had a consistent knock-on effect with respect to underspend of specialist project money for community-led teams. And that's why we see black spots across the country, whether it's Waterford, Galway. In this year's service plan, we don't see any provision for additional beds for children in the child, adolescent or appropriate wards for children for admission. And we still will see an increase in certain areas across the country where children will be admitted onto adult wards as part of an apartheid where they cannot access appropriate services. And the adolescent who spoke earlier on was quite right. It's very spotty, it's variable, the service, particularly where you come from. It may be strong in certain communities, it may be very weak in others. But clearly, mental health doesn't wait for accounting time delays with respect to service plans. And service plans have to be written with the input and political will of a minister who's going to protect that budget and to ensure that the reform measures aren't based on natural wastage, that you're waiting for people to retire, whether they're inappropriate for a service or that service is being reformed from a long-stay institutional setting to a community setting. You need to have resources for reform.
I'm going to ask Eileen Delaney, because she has a linked question to this, to give us that question now. Eileen Delaney with us?
People with mental health problems, why do they have to go...
Can you just wait for the microphone, Eileen? Sorry, yeah, it's coming in there.
Sorry, ladies and gentlemen. People with mental health problems, why do they have to go to A&E? because with being in A&E, it's not a nice place for a person to be in A&E. And what I'd like to ask each of you is, is there any other place where the mental health people can connect, rather than going to an A&E for people with mental health? That's what I'd like to ask each one. Thank you.
Thank you. And Gateway Mental Health Project have also put in a question along similar lines. Minister.
Well, Eileen, I would have to say
well, just before I'm representing Thomas Court in the drop-in centre in Thomas Street.
Okay. I would have to say to you that all of the advice I get in relation to A&Es and people who have a difficulty with their mental health, that when it comes to, for instance, someone that's self-harming, whether that's overdosing on either alcohol or drugs or cutting or, attempted suicides or all of that, then it is probably far more appropriate that people would go through A&E, because first of all they have to physically be assessed, and clearly there are instances when they would have to be medically and physically dealt with. But I would agree with you, and it's actually, if there's anyone here from the mental health team, I would have to tell you that we're putting together a group of people to look at what's beyond vision. And one of the things I want them to look at is, why do people who don't have any of the issues that I've just spoken about, but would have a relapse, or maybe, and it would have to be a relapse, because if it was the first instance, then clearly that's different. But someone that would have a relapse or an episode of poor mental health, who's already known to the services, I just do not understand why they have to go through A&E. And it would be my intention with this group to ask them very clearly, how do we manage to avoid the A&E, which is often chaotic, and for people who have a difficulty with their mental health probably makes their circumstances far worse? Why do we have to go through A&E?
But you're the minister, so why, if you're asking... No, but you're the minister, and you're asking the question as if it was a mystery to you.
No, it's not a mystery to me at all, John. And maybe if you had allowed me to continue, I would have explained to you. But we are putting together a group of people to look at what's beyond vision. And what's beyond vision will be the second plan in relation to a vision for change. And I don't think it is right that we would sort of pluck things out of the mental health strategy to do in a separate... I think it has to be an overall long-term vision, as everyone on this platform has said. And I believe that one of the issues we do have to deal with will be why people who have a recurring episode of poor mental health should have to go through A&E, which are often quite chaotic. And minister or not, I think it is important that we have it done in a planned, reasonable way and in a long-term vision way, in the same way as we did Vision for Change. And that's why we've made so much progress.
Okay. Anne Walsh?
Hi, how are you? Just on that, and the Minister was talking about relapse, I think that's the issue here. We actually, when somebody suffers with a mental health difficulty, and I kind of feel like even mental health difficulty, it's more emotional well-being. When somebody's going through something like that, really, the service should be there so that there isn't a relapse, that it's prevention, intervention, and not this revolving door system. And this is the thing that can be seen. If a person is dealt with properly, and and the gentleman, sorry I don't know your name, earlier, you were saying that, I thought it was really interesting what was going on is, in some cultures, a mental health difficulty is viewed as a spiritual crisis. So we have a model based on the DSM, right? If you study the history and politics of psychiatry, you will see where the medical model comes from. Now, like I said before, there is a place for it, but if we deal with people with psychological issues properly, relapses should be reduced. And absolutely what you're saying, there should be, the Minister said it there should be that community place. There should be a place you're going, I'm a little bit wobbly again, I want to go in. And, like, I'm not totally anti-psychiatry in any way. I have a very good friend who went through a horrendous psychosis. She was medicated out of her mind. Her whole family had to go in and beg for her to be demedicated, basically. It was horrendous. But she did have a second episode of psychosis. She knew she was wobbly. She went to the local psychiatric hospital. She was lucky enough she was near one. She said, please do not over-medicate me, but I need to feel safe. So she didn't go through an A&E, she had that. But we need something better than that. We need some sort of a community service, you know, where you can go in and you don't have to sign yourself into the psychiatric hospital to feel safe. And again, reducing this thing. It shouldn't be a revolving door model. I work with people who've been through the revolving door, who've been in and out of psychiatric care, and it hasn't worked for them because it's a different thing. It may have been a spiritual crisis or whatever they frame it as. You have to work with the person. Each individual is different. Like that young man was saying there, your experience was bullying, so it was your environment. It was nothing to do with chemicals in your brain or anything like that. That hypothesis was wiped out in the 80s. You know, if you research that, so that had to be dealt with, coping strategies, all that. So, you know, it's really to have an understanding so the person doesn't relapse, and if they do, there is a caring place for them to go. You know, so like A&E isn't the place, and you know the Minister understands that as well. So it's just preventing relapse is really, really important.
And are you saying in that answer, Anne Walsh, that the medical establishment has too big a say in the whole manner in which we approach all of this?
John, absolutely. And when that young man was talking, I nearly cried because I worked with a young chap and he came into me. I was meant to see him in where he worked, and they told me, they rang and said, no, he's grand, he has an appointment with the psychiatrist. So the following week they rang and they said, Anne, will you see him? And I said, absolutely. He'd gone into the psychiatrist, he'd got a prescription, went home and took every tablet and ended up in A&E. So that's that. And I wrote to the Minister, and in fairness I did get a reply, but I couldn't name the psychiatrist to the young man because he asked me not to name him. So I couldn't, you know. But I was so upset that he could have lost his life over that, you know. So that is happening. There is brilliant psychiatrists out there, brilliant people in the health service, but there is stuff like that happening too.
Yeah,
you know?
I know that people are offering, but I want to go just next because we're on the sub. If I take people at random and I don't know what point they're going to raise, and we've 8 panellists, it's going to go in far too many tangents. So I'm trying to put as much shape. I'm not going to put shape on it because that's impossible, I can tell you. But I'm going to put as much shape as I can. And Rachel Swan has a question on the well-being in schools, and also Alice O'Donnell of the INTO, if they're both here. So could Rachel Swan put her question next? Yeah, there will be a mic. Yeah, quick, get a mic quickly. Yeah, sorry, I'll come back to you. Yeah, sorry. Yeah.
Hey, wasn't really expecting to ask a question, but anyway, yeah. So my question was just in secondary school. It was like,
Fine.
What would the? Well, I have your question you actually emailed to us earlier. So it was about the next elected government and mental health awareness and intervention among teachers and students in school.
So,
yeah.
Yeah, I think it's very important to have intervention in secondary schools because that's when a lot of mental illnesses manifest between the age of 15 to 25. So I think there has to be more, like, yes, guidance counsellors are the first kind of point of call for people, but like there has to be more like awareness between teachers and students alike, just to spot like early warning signs. And
teachers are in a marvellous position, aren't they? Because they do see such a variety of 15-year-olds, and they've seen them perhaps for the previous 7 or 8 or perhaps 20 years. So they know more about the 15-year-old than any parent can ever know.
Yeah, exactly.
Because
so
they've seen such hundreds of them. Yeah.
So I think that if there's kind of, I don't know what the strategic way would be going about it, but like if there's more training for teachers or just a more awareness basically with teachers, so because as John said that they know the students very well, so they can kind of spot things that others wouldn't be able to.
Yeah, Sarah Jane, can I ask you to come in on this one?
Yeah, I mean, I think that's something that has come up as well. I worked with GPs who had an interest in mental health, and one of the things that I was so surprised by was that their lack of training around mental health, and specifically, I suppose, for me, I think that mental health is actually such a political issue. Some people might think I mean that in a negative way, but actually everything in our environment, how we live, whether we have any hope for the future, whether we can access meaningful employment, even our aesthetic environment, all of these things influence our mental health and our well-being. So it's not just about putting more money into acute hospitals, or, I mean, education is central to that. But I do think that that's something that, yes, okay, there might be more investment in primary care, which is needed because we are supposed to be more moving towards a community-based healthcare model. It's proven it's the best kind of model in the world, but we have to look at how people live their lives and the quality of lives that we're living. And at the moment, it's no coincidence that we're having serious issues around youth mental health when there are such high levels of youth unemployment, such high levels of immigration. You know, and your ability to be able to access a community network is really important. And these are things that have been decimated over the last 8 years. So mental health as a single issue, it isn't just a single issue.
It's a cultural issue as well, isn't it?
Every aspect of our lives. So political decisions, whether they're specifically about mental health or in other areas, they should be taken as an issue that are related to mental health as well.
Yeah. Michael O'Dowd?
Yeah, I mean, I mentioned earlier on the issue of the guidance counsellor, and I think that they had a very important role in secondary school, because you're not going to train up every single teacher in terms of identifying, you know, mental health issues. The other part, of course, is that primary school is also very important, and I know that there is various programs being rolled out, Hands Up for Children, Incredible Years programs that are doing really, really good stuff, you know, around the country, and certainly I think, well, I can't speak for anyone else, but certainly I'd be very supportive of those programs. But just going back maybe to a previous point where we were told that there's a lot of jobs there and people aren't applying for them. I mean, there's a veritable army of psychologists that have gone through third level education, and they can't get a job unless they apply for a job bridge scheme or do it for free.
The Minister says that's not true.
Well, it is true. It is true.
Well, Minister, give us your evidence, Minister.
Well, it's not true because we have put in place funding in order to recruit psychologists in particular, and I think there are some people in the audience here tonight that would have experience of what we try to do, and in fact we couldn't get them, and we're not producing enough psychologists, and we are not producing enough clinical psychologists, and to that effect we have actually started to fund training places and education places at third level in order to produce more psychologists. So it is not true actually that there are queuing up at the door, because if they were queuing up at the door, I can tell you we have jobs for them.
Okay, we're different on that. Yes, woman here. Yeah. Can you get the mic? Yeah. Yeah.
Almost forgotten what I wanted to say. Stephanie Regan's my name, and I am a Fine Gael general election candidate, but also a clinical psychotherapist, and I've been working for the last 25 years in this area. And I just want to say I think it's fantastic the amount of openness that there is now on the areas of mental health. I think Anne, I have to say, there spoke enormous sense, and I know that's the clinical kind of alliance, but I wanted to say, just if I may, one or two things that I'm very much standing on the, if you like, the issue of mental health in my own campaign, because for 20 years I've seen very little change, and I think the changes that are critical are at the psychiatric end, the 24/7, you know, people not having to go to A&Ds. Unbelievable that people have to do that who have recurrent, you know, chronic illnesses, and that is the case, and they have to queue and they have to stay. And for people who have a mental illness, usually the first thing, and often a very first indicator, is that they have lost their patience. You know, they have become a little bit anxious, a little bit irritable. I'm talking now at the psychiatric end of things. So it's absolutely critical we get that right. I think it's dangerous to say that we are over medicating people. I have to say that, and I'm a psychotherapist, so I have really worked in that talking therapy cure way. I think it's really important that the medication works. Medication has a place, but
it shouldn't be a first resort.
And it is not. It sometimes has to be the resort.
No, it may be used first, but it shouldn't be in the medical person's mind. It shouldn't be the first resort.
But sometimes in the clinician's mind, sometimes even on the first session, that talking is not going to do this, and that is not the right answer. So I think it's really important to put that there. It is. So what is required is that people are never medicated alone. That it is just not handed to them and they walk out the door. We've all seen that, terrible stories. And it has to be part of the holistic kind of response. There is no doubt that housing and all these issues around, these are huge issues, and they cause stress and strain for everybody, and that's all the beginning. You know, the beginning of a continuum, if you like, of health. But one thing I would really like to, if I may bring across, and get the words on it correctly. One of the reasons that I find myself really frustrated is that there's so much great science now about how to keep people well, how to keep people in a good state of mind, how to be positive, how to keep yourself in that place. And we're not getting that information out to people. It's one of the reasons I have to say I've got off my couch, as they say, and decided I'm going to stand for election, because there should be rollout campaigns, not only in the media. There should be rollout campaigns in schools, and at every point of transition. The science shows this, the research shows us, this is where people have problems. When they move from primary school to secondary school, when they move from secondary school to college, and let me tell you, when they go on transition year from college, these are critical points. We are not doing enough, and I'm telling you, people, that is when people fall. So if we know people are having problems at change points, why aren't we teaching them the skills? It's absolutely bog standard. It is there. The information is there. It's not even difficult. And we're just not getting that across, and that is what I intend to do.
So, but you are talking about a change of culture, where there's a wider appreciation by educationists, by teachers, by all politicians in all departments. It's not just a single solution.
Absolutely, it's not a single solution, but it is a mind shift. It's not enough just to talk and say, I was depressed. You know, people coming out in the media, it's very good and it helps. But we actually have to see that it's a little bit like we have taught people, for example, not to smoke. We have taught people not to overeat. We need to help people to understand that actually positive thinking and helping themselves to be fit, to eat well, all these things interconnect. If you haven't got somebody to confide in, maybe there's another way to do that. You know, it's a whole series of little things that keeps our well-being. Almost, as I often say to people, like a child's mobile. You know, it kind of stays in just a semi-equilibrium, and that's what we need. And we need to help people to understand that they play a part in that. It's not just when you get sick. You've got to stay well.
Yeah. Okay. Somebody with the microphone? Yes, you can talk, but we will get a microphone to you first. Yeah. Okay. Yeah.
Thank you. Hello.
It's on. Yeah. Try it first, anyway.
Hello.
Yeah.
Okay. I'm very grateful to be here tonight. I'm so excited. I would even sit or stand for the time. I'm a mental health service user, and I've decided I want to become an advocate for mental health. With all the negative publicity, yes, I think there's a huge amount of positivity, and I think we don't just need funding. I think we have an army of people that are willing to give as much as 110%, like myself. I have a few questions. The first question is, why haven't we got a national database of all mental health services in the country on the one website, including places, day centres, every single thing? It should be all on one website. I recently mentioned it to somebody in a hospital, and they said they were going to be doing it next year. Why isn't it already here? You go on mental health, you see a few organisations. I know a particular one that's hardly on any organisation, and it's excellent, and it's free practically, and it could be rolled out in schools. Why isn't there a website that I can go on that gives me all the information of what's going on around the country in every district? Why isn't there also updates on what's happening in mental health, in the mental health area? Why can I not attend a conference on mental health? I want to be one of these people who's able to impart that information to other health service users. I don't have any education, only leaving cert. I would be willing to go around the country, why isn't there, talking about community mental health, I could volunteer to go around where you have sports community centres in every village in the country, and people could address and talk about mental health. They don't even know where to go.
And is it your point that people who are involved and have the experience of mental health problems are very often able to reach out to others with the same challenges in a way that the medical profession isn't necessarily going to reach out?
No, my point is there should be basic information in the community. I have spoken before to a group and somebody came up and said their husband or someone was in difficulty, they didn't know where to go for support. I was this morning, I was speaking to somebody who had been in a mental health service, and I happened to ask him how he was. He actually was suicidal. He said he can't speak to his wife, and he has been sent out of hospital. And he said, well, maybe I don't know what to do. I can't talk to anyone. I'm going to a counsellor. And he then said, well, maybe I could leave it for a few weeks and my mortgage will be paid for. I have my own business and maybe I'll end it all then. I actually had to go to somebody and make people on his team aware that this man is suicidal and happened to be come in to do a day programme, and I happened to listen, told him of my own experience and told him, you need to be in hospital, you need to look after yourself.
Okay. Thank you very much. Yeah, this gentleman here, yeah. Somebody with them, somebody that had, yeah.
I'm Peter Hughes from the P&A. Just a couple of points. The Minister talks about delivering or setting up a group regard beyond vision, but there are a lot of elements of the vision 10 years on that haven't been delivered. Like, I think a lot of the beds have been reduced, but the community services are not there. And if we look at people presenting to A&E or
Your microphone is turned off. I think you're fiddling with it. It was on. Another one coming, okay.
just in relation to, service users having to go through A&E, if there was a 24/7 community service, and a lot of those people that present after hours, present after 5 o'clock, that would help to resolve that. 20 years ago, I worked in a crisis intervention service in Australia, 24/7, and that provided a lot of that service after hours. And there was a time limit that you had to be where the person was within 1 hour. So I think that would help resolve some of that. There's also the issue you mentioned about resources or can't get resources. Like, from psychiatric nurses' point of view, the present government introduced the graduate nurse scheme, which drove the young psychiatric nurses out of this country, and now they don't want to come back. And they had a Bring Them Home campaign, which in my knowledge, I think delivered 9 nurses from the UK coming back. So,
and why would they not come back?
They wouldn't go back because the conditions aren't here for them to come back to. And because...
Do you mean pay or do you mean conditions?
At the time, when they qualified, they were offered a graduate programme, having already got their degree. They were offered 80% and then 90%. And they were so disgusted with it, they went to the UK, and we spent 4 years educating these nurses at a cost of approximately 90 to 100,000 per nurse to export them. And they don't want to come back now because they have left with a sour taste in their mouth. Yeah. The government here brought that initiative in. It's now seems to have gone away, thankfully, but it left a bad taste in a lot of young nurses. And now we have got a problem where we don't have enough nurses trained, and those that we did train have left the country and don't intend coming back, probably.
Anybody want to pick up on that?
It's a complex industrial relations problem, and my own view is that the Vision for Change was used in an austere way with respect to cost saving, and that the reforms that were required or embedded in the vision were going to happen through natural wastage of non-core staff. So as we were shifting the model from a residential acute setting to the community, the resources weren't there to recruit. They should have been there. There was €35 million ring fence per annum per year, current expenditure to be spent every year. 35 year 1, 75, 70 year 2, 105 year 3, and every single year it was robbed. And therefore, we're still waiting for a domestic or a security officer or a gardener to retire and get to the age of 66 before we can recruit a nurse. And that was the strategy over 11.
Many years. Yeah.
Over 11, 12 and 13, and I've been at those presentations from the HSE. And Minister, it may not be your will,
not all parties,
but that is the strategy.
Haven't all parties got sort of responsibilities in that period, and you've been in 2 of them, so you should.
I have been in 2, and clearly I've seen the closure of 22 beds in Ballinasloe, the only ligature-free unit in the country. €3.2 million of perfect, never opened, wonderful acute services. And I don't believe people who are in a vulnerable, emotional situation should ever present themselves at GUH, at an A&E, ever. They should present themselves at admission units, across psychiatric appropriate services that are not grey, that are not lockups. The idea that you would present yourself with an emotional injury at GUH ED on a Saturday night where people have been lying for 48 hours waiting for a bed in that state is highly, highly inappropriate, and it's a no, 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 and must stop.
Okay. Caoimhghín Ó Caoláin.
Thanks, John. I think the point that the last speaker made is very, very important. There are lots of fine points being made by speakers from the panel and excellent contributions from the floor. But to address the complexity of our mental health needs today, we need to resource. It's not just money, it's about critically providing the necessary staffing. We have now 1,200 fewer people providing mental health services today as against 2006. That's 1,200 fewer people actually serving the needs, the mental health needs of our communities. That has to be addressed. It is absolutely essential, because all of the fine plans and all of the other detail that has been outlined will require that critical mass of people, properly trained and with the expertise necessary to deliver it. So I absolutely agree with the speaker from the PNA. I think it is essential that that's a core element. It's like the address of the deficiencies in terms of the capacity of our acute hospital system. It reflects exactly the same. And if I can, just to make one other point, John, because it may not come up again and you may not afford me another opportunity, I don't know. But I think the point about counselling and talk therapy, and I'd just like to commend the young man who spoke from the front here this evening. And we've been referring to the needs of young people. And I'd like to make the observation that in terms of bringing in guidance counsellors, it's not just about giving a steer in terms of a pathway to a career. It's about actually dealing with the issues and the needs of young people today. 1 in every 7 of us annually has a mental health experience, a challenge. And that's something we all have to be upfront and frank and honest about. However, my view is that in terms of addressing the issue at school level, that it isn't only about the individual young person presenting. It's the whole of school need. The whole of school need, because it's not just the 1 in 7 that we need to help, we need to address. It's the 7 of 7. We need to be able to address the gentleman who talked about the member of the judiciary and their failure to properly understand and appreciate the complexity of the case in relation to his brother that presented. That's a consequence of our failure to address in a whole of school way the importance of respect, the importance of acknowledging the individual. And it's not just at school level that we see examples, and I'm coming to a close on this, John, that we see examples of society's failure to respect, to understand and to appreciate. I would like to say that that's where we need to start. But in the past 12 months, and I want to join with the earlier reference by Regina to the important support that mental health reform give to the all-party mental health group in the houses of the Oireachtas and Laura Kelly in particular here in the front of Dr. Shari McDade. It's invaluable support that you give. But I brought to their attention last year. I had 2 cases last year.
No, I'll stop you there.
Well, if I can just...
I know, but
it's very
there's
quick.
so much.
No, it's very
quick. No, I will stop you because...
I'll
stop you because I have too many people who want to come in from the floor. Yes.
I did more...
Okay.
John?
Right. Somebody with the microphone, if they have it, yeah. Can I advise those with the microphones to give them to people with their hands up? Yeah, because then I can call them in, yeah.
Hi, my name is Claire.
Sonia.
Apologies, I'm not used to this. And apologies for my teeth missing. I had to get them out. I'm very sorry. My case is complete. I'm talking about myself. I'm a service user. And I could write so many books about my experiences. And I'm very lucky because of my own strength that I'm here today. They won't take me into hospital at all. It's like when I'm suicidal, I go to the A&E. Then it has happened to me in one hospital. The psychiatrist actually laughed and smirked at me, and she was yawning. And I said to her, well, you know, am I boring you? Am I keeping you up? And another time recently, I went to the same hospital with a different psychiatrist. And I stayed the night, and then she told me, you know, you have to go home. I said, I'm not ready to go home. And I said, are you happy about sending me home? And then she says, are you threatening me? Because I was being assertive. I said, I'm not. I'm just stating the case that I'm not ready. And what they do then is they fob you off. They send you off to the public services. But in the public services, you're allowed 20 minutes, if you're lucky, to talk to a psychiatrist, and they change all the time. The registrars, I think they're called. So, you know, how can you get close to someone? And sometimes they don't even have the notes in front of them. For God's sake, it could be anyone. It could be anyone. You know what I mean?
Yes.
So because I got some money on, someone gave me a present, but I had actually to hand up the money. I was told I could have a hospital bed at a private hospital if I gave them the money first. And I had to do that. I had to go through all the rigmarole of GP. GP has told me, I don't know how many times, I'm not to be coming there anymore about my mental health. One psychiatrist told me he had depression himself. And he said to me, I cannot walk into the clinic when I like. And I said, well, I am suicidal. Where am I supposed to go? Where am I supposed to go? So he listened, and he was okay eventually. But I just find that the public health is completely different to the private health. There's a 2-tier system. I'm lucky I'm able to say what's up. But if I didn't have this strength, I would be in the Liffey. I would. There, thank you.
Thank you very much for your contribution. Somebody with me. Yes.
Hi, my name is Adele. I'm 25. I just wanted to ask the panel, you both talked about new services and new doctors and everything, but most people now, their first point of call would be their GPs. And myself, I went to my GP 3 years ago to tell them that I was depressed, and basically told me that I had no reason to be depressed and sent me on my way with nothing. And it took me
Was your family GP the first time?
I didn't have a family GP, so I was
Right.
just out of college. I
Right.
was using the college services, so I didn't have a GP that I knew. So I just had to go to a new one. But I think a lot of people, especially out the country, that have the same problem as me. A lot of my friends are on antidepressants, and they cause similar problems where health professionals don't take it seriously because they think at our age we shouldn't have the type of issues that we're having. And I just wonder if there's a further place to improve those services.
Yeah.
Well,
That's
we-
a very important question. Yeah, Minister.
Well, we have started working very closely with the Irish College of GPs, which I think is essential because for most people, GPs are their first port of call. And there is a whole training programme put in place in terms of mental health. And I say mental health because I know I've been watched. Mental health and the GP service. And that's why as well we've expanded the SIPSI service, which is counselling in primary care. Rather than having to go automatically to maybe the psychiatrist or whatever, that people with very low grade maybe depression at the time, which is an issue, and you recognise it. We have actually given additional funding this year again for that SIPSI service, that counselling and primary care service, but we are working very closely with the Irish College of GPs, and they are the recognised body for training in terms of GP services. And could I also say that I think it is very important that we start to recognise that at the end of the day, GPs have a pivotal role to play in all of this, whether it's by directing people to the right services, because it can't always be about acute units or at that level of care. It must also be about community-based and the right information.
Right. Anybody else want to come in?
Yeah, I just want to say that both in the stories that are referred to here, the examples referred to here, and also certainly my experience of people coming to me, the problems just keep repeating themselves, and that is that people in difficulties with mental health problems or in very acute cases of feeling suicidal don't know where to go, don't know what services are available, and there really aren't the services there available that are community-based, that are accessible, that are properly staffed and properly resourced. That is the reality. And was often when we think about services, it's sort of abstract. Services, more than anything else in the mental health area, are people. They're people, right? They are trained people. So that's what we're talking about. And if you don't have the people, if you don't have the psychologists, if you don't have the psychotherapists, if you don't have the therapists and all that, and indeed if you don't have class sizes that are manageable for teachers, how can they possibly interact with individual students and deal with their problems and so on, right? So it is about people. Our schools are understaffed. Our mental health services are understaffed. And unless we deal with that, we're on a hiding to nothing. That is the reality. And I do want to, I have to say, strongly disagree with the Fine Gael candidate over there about the issue of are we or are we not over prescribing these drugs. I'm not saying there can't be in some cases, sometimes, although I think it is far, far less a value to these psychotropic drugs, but I do think there is a massive pressure. And it's not just anecdotal evidence. You talk to people in the field and they're saying this is what's happening. The pressure is on because the real resources that we need and the supports that we need are not there. The pressure is on just to give people drugs. There's no question about it. And they don't deal with the problem.
Just because you shout it doesn't make it true.
John,
okay,
I think
so
it's
not
pretty unfortunate.
Strongly about it, Regina.
Unfortunate. The incident with the GP and early intervention is critical. And you are now arguing that you're in a different or even a more challenging situation. And I get the very strong suspicion from my own experience with GPs that they have nowhere to signpost an appointment to because there are less beds. There are complex emergency departments if you don't need a bed, you need a community. You need a hospital and a virtual hospital in the community. And I'd like to ask the service user in the front, when you didn't get admitted, did you have a team of people following you to your home? Did you have an appointment? Did you have people call to you regularly? Did you have counselling in your house, in your community? It wasn't there. Yes.
If he hadn't got back, I know I would have taken tablets. And the thing about it is, every audience is saying, I have tablets alone. You know, I shouldn't have had them, but anyway. And I was lucky enough to go private this time. Great care, but it's like I have to run after the services myself. I'm not always able.
My point being that sometimes we do need a vet. Sometimes we do need acute health. And there's less of that. And that's the problem.
Yeah.
And I don't think GPs are confident that the backup is there, whether it's acute, community, and that intervention. John, I know of children who are being referred for acute supports and are being told, I'm sorry, that child should be with the Garda services because we haven't got the capacity to take care of that child's needs. And that is inappropriate.
Could I just add a point, John, to the Minister's point in relation to counselling in primary care, the CIPC that you referred to? It is absolutely vitally important that there is a significant increase in investment in that area. You know, 1 in 7 of our population that we cited earlier equates with 644,000 of our population. Yet in 2004, and I don't have the stats for the year just gone by, there were only 14,400 referrals through the CIPC. That indicates that we're falling far short of the need in terms of the role that primary care can play in direct response to the needs of our people. They're the most accessible level primary care. We need to significantly increase investment in that area.
Right. With the microphone, yes. The young woman with the microphone. You do need the microphone, I think. So can we just sort that?
This one working? Yeah, okay, grand. Okay, sorry, I've just heard a lot from a lot of people talking, especially with the lady back here talking about younger people. And I'm a first-year college student, and I seem to just have that sort of personality that when someone has a problem, they come to me and talk to me about it. And I've had 5 people in particular come to me in the past, talk to me about mental health services, and 2 of them are now dead. One guy hung himself, the other guy took an overdose of pills. The guy who hung himself, his mum was a nurse and refused to deal with him. I've had to talk one of my friends down from a bridge multiple times. One of my friends, when he went into mental health services in town, he was told that girls would deal with it better, and therefore, you know, he should go out and deal with it himself. And the other guy is too afraid to go out and do anything because there's building works in his school. So when he went in to talk to teachers about it, they told him they were too busy with the building works. Could he come back to them later? It seems to be that men in particular are brushed off so often with mental health services. I'm not saying women aren't, but men in particular seem to have these particular pressures on them, and it's ignored so often because we have to be fair, we have to everything. But we have to realise that young people, and even if you're looking at just young people in particular, men in particular, have all these problems. Sorry, two of my friends are now dead because of the pressures that society has had on them. And for God's sakes, what are we doing in particular for young men to stop this happening in the future?
I'm going to move to the panel now and ask them this question. That I know we've had a variety of opinions from the audience, and there's also a lot of there's a lot of consensus across parties on this issue. I think that's true. And it's not that surprising, because I think politicians in general are very well intentioned, and because there's so much to do on this issue, and in a way we're starting perhaps from a place that that has happened. It is organically grown, and the model may not be the optimum one, but it's the place we're starting from. And the question is this: how big an issue should this be in the forthcoming general election? And what would your priority be? Now, don't give me a huge list, but if there was one thing that you could do, only as an indicator, it doesn't mean that you wouldn't do any other matters. But as you read it, what would your priority be? Richard Boyd Barrett first.
Well, the overall priority to mental health, I think there's huge desire, appetite, if you like, in society at large, and a growing awareness that either they know people who have mental health difficulties, or they know that they have had them themselves, or that they will have them at some point, right? So I think there's a huge understanding that this has to be a priority. And I mean, you see, really you have to have all of the things we've talked about. You have to have them all. And it's a bit of a Hobson's choice to say which of the 5 things that we all agree should we take, because we shouldn't have to make that choice. You know, it's a little bit like, should we deal with the housing list of 100,000, or should we deal with the people who are homeless on the street? We should deal with both, and we shouldn't be asked to make the choice between one and the other. But if you're asking me, we can only have one, well then obviously it's
I'm not asking you that. It's self-evident that we need a cluster of things. I'm asking you to not, because I have 8 panellists and about 8 minutes left before we have to leave.
Point, but
well, what would your priority be if you were the minister in the morning?
Well, then you are asking me to put a priority on them.
Oh, I am, yeah.
Well, then it would have to be, but I believe you have to have them all, but it would have to be the 24/7 emergency. Of course it would, because they're the most acute emergency things. But I'm sorry, you have to have all the stuff behind it so that we reduce the number of people who are finding themselves in these difficulties.
Okay, Sarah Jane Hennelly.
I think there is a reason why we're all agreeing with each other. We are coming up to a general election, so there is a lot of people being very positive about things, but we can always look at our track record, and it hasn't been good. And coming up to election time, people make promises, but you have to look at the past. And the only way we can prevent and decrease the numbers of people committing suicide, numbers of people finding themselves in crisis situations, is if we prepare future generations and prevent them from finding themselves in those situations. So I think interventions and community-based interventions, early interventions and prevention in schools, that is the way forward.
Anne Walsh?
John, there was another part to your question, priorities. You said something.
No, how important is this issue in your view in the election?
Oh, it's huge. It's actually, if you've got good mental health, good psychological well-being, there would be no wars. The Dalai Lama said, teach everybody to meditate when they're 8, 30 years' time, no wars. My priority would be for everybody in Dáil Éireann to do 20 minutes meditation every morning, to get their cortisol and adrenaline down, to stimulate their prefrontal lobe, which is the God part of your brain, so that we can actually create a better society. So that would be my priority.
And if you're
I'm
elected,
looking forward to Anne getting elected.
And if you were elected, would you lead these groups yourself within the Dáil?
I would.
Take
no bother.
Yeah. Close the bar and open the
change
the Anne
menu.
Walsh Centre. Michael O'Dowd.
Yeah, I think my priority certainly would be in the whole education area, so that individuals can build coping strategies and build resilience and cope with what the world has to throw at them. Just one point in relation to all the stories that we've heard. I mean, I suppose originally come from fighting and advocating on behalf of people with disabilities, intellectual disabilities, and there's a saying there, nothing about us without us. And I would suggest to the Minister that when she's working out these strategies with the GPs and looking at why we don't have 24/7, that she talks to the service users and makes sure that they're part of any negotiations or discussions on it, because their stories are really very powerful and should be heard.
Caoimhghín Ó Caoláin?
All of the before mentioned, and I would add, I think we generally tend to take a view that societally we're moving away, and that the stigma aspect of mental health issues is abating. I have it to say, regrettably, that I don't believe that is the case. I think there is a huge job of work to be done in this area. I think it is absolutely essential that we confront the forces in society that continue to discriminate against people who have been brave enough, bold enough, willing enough to acknowledge that they have had a mental health experience. And I have had examples, experience of people who have been discriminated against within their employment, within the public service and within the private sector. And I think it is absolutely scandalous. And that needs to be confronted, because that's a part of getting the message across that when you have a mental health difficulty, like any other health difficulty in life, you can get well. And people are entitled to have their wellness respected just as anybody else with any other physical challenge in life. There are too many examples of lives being destroyed on a secondary basis, having been open and frank and honest in relation to a challenge that they have known.
Colm?
Well, John, there's no doubt that stigma is a great stealer. I live in rural Ireland. I live in a town that has a very high population of settled travellers who have a disproportionate propensity to have a death by suicide. So stigma is a robber. It's a dark robber. But can I credit Minister Kathleen Lynch, despite the fact that there is a perception that we hate each other, we fight each other, and that there is no other politician of the 166 that have the honour to hold a seat in Dáil that has managed to change the language around mental health. And despite what Kevin or Caoimhghín has said, I think that that's going to be a significant legacy, and that's not preempting the next election. But if I look back at the course of the last 5 years, Kathleen Lynch has done a wonderful job in changing stigma and language around this debate. For me, I think mental health deserves its own home. That home is not the HSE. The HSE has been pickpocketing and robbing, stealing, the competition between professions, and I think that we should have a mental health authority, just like the Gardaí have the road safety authority. There are 200 less people dying on our roads, and I think we should have a distinct authority that develops policy and protects the existing budget, protecting the budget, not asking for more, but spending what we have and protecting what we have, and to ensure that the competing resources at Cabinet aren't going to mental health, because it's been the Cinderella of the public health service. It's been robbed and robbed and robbed. And that's no reflection on any one person, because I think under the circumstances, and I've broken bread at Minister Lynch's table, I think she's done a wonderful job under the circumstances, and her legacy around language has been great. But I think, that there are elements in government that see mental health as soft, and therefore we can rob. And there, I believe that the authority can protect that away from the HSE, and therefore we can go and protect and underpin services.
Regina Doherty.
I get very afraid when Colm starts throwing compliments around from the government's perspective, but they're very welcome.
He didn't name you, he named...
No, I'm taking credit. I'm still in government circle. You asked me the question of how big an issue will it be in the general election. I think, unfortunately, it won't be big enough. And I only know we're all canvassing. It's not something that people bring up at the doors. And that goes back to the point I made a couple of hours ago. So if it was me in the morning and you gave me the file and said, off you go. For me, apart from obviously all of the structural changes and the supports and the positions that need to be filled, and they are a priority, peer support, community power and involvement, and the acceptance that it's okay to be not okay, and for people to discuss it within families and friendships and neighbours, and to acknowledge that it's just as normal as having a strep throat or breaking your ankle and having a pair of crutches for it, until we get to that level, and not to make it...
But we're nearer that level now
well,
than we were, aren't we?
We absolutely are, and it's testament to Kathleen's attitude for the last number of years, but also people and society are changing. But they're not going to change fast enough until we have the educational programmes that my other colleagues on the right here have suggested, and it needs to start, as Rachel said here, I think earlier on, in school, with our young children in primary schools and in secondary schools, to empower people to have the confidence to be able to discuss it, to offer peer support in our neighbours and communities, and then to be backed up by the professional services that do have challenges. There's nobody, with respect Politicians who are not in charge of the chequebook will tell you, oh, in the morning I do everything. Well, we don't have the money to do everything. So we do recognise there are challenges, and the economy obviously was goosed for a number of years, and now it's getting better, so we will have more money. And we will get to the 10% magic spend that we will. But even when we get there, that won't be the aspirations over and job done. We'll still need to strive to do more. So I think we need to learn to support each other, as well as expecting, obviously, the statute bodies to provide the services and the money to resource those services, as we all expect, and that would be my priority.
We're also entitled to some accountability.
Oh, absolutely. Well, that should go without saying, and that doesn't cost any money.
But it doesn't go without saying.
Well, it should.
And thank you for saying it so eloquently. And your brother is very fortunate in having you as his brother, I may say, as well. Minister, if you've recovered from the compliments that Colm Keaveney has been paying you, what is your view of this as an election issue?
Well, I suppose because I hold a position I do, I regularly, people come to me and say, either I'm not doing enough or I'm doing great work, or, it's the usual mix. And I mean, this audience is as wide-ranging a mix as you're going to get in any society, and I think that centrally is important. 5 years ago, and I see a lot of people in the audience here tonight that I would have worked with over that 5 years. 5 years ago, the conversation around mental health really was non-existent. I see Sherry, and I just find we often say to one another, would it be possible to hold a meeting like this and get this type of cross-section of society, or this many people to come out and be open about their difficulties in relation to their, whether it's emotional wellness you want to talk about, and Colm talks about language, and I'm a great believer in changing language to change attitudes. 5 years ago we wouldn't have had this interaction. 5 years ago it was a different society. 5 years ago mental health wasn't something that we spoke openly about. One of the surveys that was done by the NDA 5 years ago asked people, what would your attitude be towards someone with mental health difficulty living next door to you? And 97% of people said, I didn't want it. And I said, I have news for you, they're living there. You just haven't recognised it yet. And I think that if we're serious, really serious, about us being holistic beings, about our mental health being as important as our physical well-being, and understanding the interconnection between the two, that one has an impact on the other, whether it's physical or mental, that really and truly, if I could be assured that the next government would hold the spotlight on mental health in the way that this government has, then I think that we will make serious progress. But it is about attitudes, it is about culture, and it is above all else about language, about ensuring that we don't pigeonhole people because they have a difficulty. And the other thing I would say to those who have a difficulty with their mental health, or who have been through the services and come out the other side, or are still within it, the other thing I would say to them, it does not have to be lifelong, or in fact something that impinges detrimentally on your lifestyle well into the future. I think that's important. But and I see a lot of people in the audience here tonight that would have heard me say this before. When I go around the country and when I do particular things like opening new units or, developing new services, there's always the psychiatrist that stands up before me, that stands up to tell me, what I'm not doing. And that's okay, because I need to hear that. And that's why I come along to audiences like this on a regular occasion, not just tonight, not just because there's an election looming. I come every time I'm invited. And every time the psychiatrist stands up, he usually, and it's usually a him, finishes off by saying to me, but we're not there yet, Minister, as if I needed to be reminded. As if I needed to be reminded. And my question is, where's there? Are we so certain that we know where this will all end? Because if we're serious about mental health and delivering the service and being creative and demanding that we learn more, because we have learned a lot, surely we should be open to the road that opens up before us, and not just be so fixed on the journey's end, because we don't know where that is. And I think that mental health, and I take Pierce Finnegan's view of this really on board, mental health really is about all of us. And it is about all of the services, all of us. And anyone that tries to capture it into one single area, we should resist that. We should resist that. We're all in this together. And we have extraordinary people who are out there prepared to help others, whether that is service users themselves or indeed the professionals that work in the service. They are extraordinary and they are willing to help. And I think we should accept that as well without constantly pointing fingers.
Okay. I'd like on your behalf to thank our panel, Richard Boyd Barrett, Sarah Jane Hennelly, Anne Walsh, Michael O'Dowd, Caoimhghín Ó Caoláin, Colm Keaveney, Regina Doherty and Kathleen Lynch for joining us tonight, and also all of you for joining us and for giving us your own testimony. Sometimes you ask questions in many sequences, and it was as much a statement and a contribution to the debate. I am absolutely aware of how many people sent in questions by email which we didn't get to ask them to ask the question. But that is in the nature of this style of debate because of the multiplicity of viewpoints in the audience, and because we have as many as eight panellists, and some of them represent bigger groups in the Dáil than others, and we at the same time we were giving equal space to them. And I would like to thank particularly the larger parties for accepting that. They don't always accept that sort of ground rule, but they accepted it this evening. I'd also just add this point myself, that we have seen big changes in areas like tobacco, where Micheál Martin's achievement, I think, was absolutely, it was probably going to happen, but he accelerated it very much when he was Minister for Health and played it politically with extraordinary skill, and has saved lives not only in this country but around the world, because if people said, well, if the Irish can do that, then we can do it. We did it first, and so on. And likewise in road safety. And that's to do with how we handle drink and driving and drugs and driving. And that's another social change. So we need a change on that huge behavioural level in this issue as well. And all such change happens in three steps: knowledge, attitude, behaviour is the third. So we now, I think, as a society, and you've heard there in the answers, that there is generally now a much greater appreciation of mental health as an issue in the election and as an issue in our society. And that is a huge first step. It is an asset, it is a piece of capital on this agenda that you could not exaggerate its importance. Because you've got knowledge first, then you get attitude, I wish we could change on this, and then you may get behaviour. So we may be in a 10 or 12-year cycle, and we're in the middle of it, when we may be coming to some achievement which will be to the credit of all our politicians, insofar as they will be leading on it. But we also need to change probably the basic education of the next generation of doctors, the next generation of teachers, and the next generation of parents. And on that agenda, and let me say this finally, as a broadcaster, broadcasting has an amazing effect on people's behaviour, mainly because they happen. The very people who mightn't take a book down on an issue or will turn the page in a newspaper, they bump into a debate, or they see something on a popular drama serial on television. They will see some issue being debated, and it engages their attention. And the final point is radio as an incremental debater of issues. Television tends to say they'll do a documentary on sugar, and they did one last Monday, which was pretty frightening. But radio is much more likely to keep going back in telephone interviews and in different bites of these agendas. And radio has an amazing role to play. And you people in this room, not least the people who gave us their own testimony and spoke so eloquently, particularly our first speaker here, this young man in the audience, contributing that to radio will engage the Irish public in a way that you would, again, be difficult to exaggerate, because that's where this will happen. You need a societal sort of change. So I'm very aware of the limitations of this debate, but I'd like to thank you and our panel for contributing to it. Thank you very much. And Shari McDade just wants to thank you on behalf.
Can I just thank you, John Bowman, for excellent chairing of the debate. And can I just say that John Bowman has given a huge amount of his time, his personal time, to preparing for this debate. And we owe him a great debt of gratitude in being able to chair so wonderfully. I know that each and every one of you will make mental health a priority on the doorstep. So join us in doing that, and good luck.
Science is all right. Is it your meditation? Yes.
The type of therapy I use, I had it checked out. The party I joined, I had it checked out.
You do the very best.
Thanks very much.
How are you?